Sudden cardiac arrest. Hello and welcome to the channel. A few years ago, I went on holiday to an Italian island and was absolutely chuffed to bits to learn that there was a marathon planned for the island the very next day. It was an activity holiday anyway, and the possibility of starting it already on day one with a marathon was something I was relishing. I knew I was in a good enough shape to run at least a half marathon at short notice, so my plan was to sign up for that. The next day, I turned up at the starting line, decked out in my sporting gear, ready for action. I went in for registration. I filled in a form and handed it over to the official, handed over my payment, expecting to get my bib with my racing number on it to stick on my back and start running. And the medical certificate? Il certificato medico? The official asked me, extending his hand out at me as though to receive something from me. Huh? What certificate? Your doctor's certificate, signora, he asked again, no doubt thinking to himself, God, these bloody tourists who don't understand anything. But I don't have a doctor's certificate. Ma io non ho un certificato medico, I informed him. Then you can't run today, signora. Sorry. Allora non si può farlo oggi, signora. Mi dispiace. Oh no, I was gutted. I didn't know this at the time, but in Italy, and indeed many European countries, you are not allowed to take part in a marathon without a doctor's certificate. Crushed, I tried all the tricks to bypass the rules. I swear I'm healthy. Hey, I'm a doctor. I shall write myself a certificate now. But I run marathons all the time. No one asked me for a certificate before. All my protestations were to no avail. They fell on deaf ears. No chance. I was booted out of the marathon, forced to watch from the sidelines. I ended up running a marathon that day anyway, but with my own entourage, on our own terms, with our own bespoke route. Of course, I now know why they have this rule in Italy. Italy and other southern European countries are a hotbed for a particular problem that everyone should know about, and which is a devastating cause of sudden loss of life. This video is dedicated to this and other causes of sudden cardiac arrest. If I asked you what your number one cause of sudden cardiac arrest was, you would probably say heart attack. This is not wrong, but did you know that most people who pass away from heart attack, at least in this day and age, do not pass away suddenly? When a heart specialist thinks of sudden cardiac arrest, there is a list of heart conditions they think of. Believe it or not, a heart attack is at a lowly position of 8 or 9 or so on this list. Just a little clarification of terminology here, because I think we often get confused about the exact terms medics use. A heart attack is a situation where one or more of the heart blood vessels gets clogged up. This may lead to collapse or even death, but as I said previously, it is rare nowadays for this to happen suddenly within minutes. Public health measures have reduced this possibility immensely. Shout out to my cardiology colleagues. A sudden cardiac arrest happens when the heart stops beating suddenly. This is the topic of today's video and can have many causes. In effect, a heart attack is a heart plumbing problem, and sudden cardiac arrest is an electrical problem. This image captures the difference very well. Shout out to DFib Tech for the picture. Let's dive in. Sudden cardiac arrest, or SCA, is an unexpected heart stop caused by the sudden loss of heart function. It is responsible for nearly 20% of all deaths worldwide, claiming millions of lives annually. Despite advances in medical science, SCA remains a major public health issue, often occurring in individuals without previously known heart disease. This is important, especially in the young, especially in young, fit and sporty individuals. SCA occurs when the heart abruptly stops functioning due to an electrical or structural problem. It is different from a heart attack, which results from blocked coronary arteries. While a heart attack can lead to SCA, SCA occurs primarily due to the heart's electrical disturbances, particularly ventricular arrhythmias or heart rhythm difficulties. The heart may enter life-threatening rhythms such as ventricular fibrillation, VF, or ventricular tachycardia, VT, causing the heart to stop pumping blood to the brain and other organs, leading to sudden death within minutes. SCA can affect individuals of any age, though it is more common in older adults, particularly those with existing heart disease. In younger populations, especially athletes, SCA is often due to inherited or congenital conditions, whereas in older adults, it is more commonly associated with coronary artery disease. So, other than coronary artery disease leading to electrical problems like VF or VT, what else can cause sudden cardiac arrest? Cardiomyopathies are a group of diseases that affect the heart muscle, often leading to SCA due to arrhythmias or heart failure. They include hypertrophic cardiomyopathy, or the worse variant in this case, hypertrophic obstructive cardiomyopathy. This is a genetic condition characterized by thickened heart muscle, particularly the septum, the wall between the two ventricles. This thickening can obstruct blood flow out of the heart and create electrical instability. Hypertrophic cardiomyopathy or hypertrophic obstructive cardiomyopathy is a leading cause of SCA in young athletes. It's often been the case that footballers who have died on the field have had undiagnosed hypertrophic cardiomyopathy. Dilated cardiomyopathy is another type of cardiomyopathy characterized by an enlarged and weakened heart, which impairs its ability to pump blood. This leads to heart failure and increases the risk of arrhythmias, heart rhythm problems, which can precipitate sudden cardiac arrest. Arrhythmogenic right ventricular cardiomyopathy, ARVC. This is another genetic disorder where the right ventricle's muscle tissue is replaced with fatty or fibrous tissue. This replacement tissue disrupts electrical signals in the heart and can lead to life-threatening arrhythmias. This is the disease that is highly prevalent in Italy and Southern Europe. Many professional athletes have died on the field because of this, particularly in these countries. Sorry about this, just had an ambulance go by. Now, ARVC is the reason why I wasn't allowed to run my marathon without a doctor's certificate in Italy. Other congenital heart diseases, for example, tetralogy of Fallot. This is a condition involving 4 different heart defects that can reduce blood oxygen levels. Very complicated disease, but the end result, which can be extremely dangerous, is the degeneration into electrical storm, what we call electrical storm, where the heart goes into repeated episodes of ventricular arrhythmias. And this often happens in childhood, sadly. There is another congenital heart disease which is more subtle. It's called WPW syndrome, otherwise known as Wolff-Parkinson-White syndrome. And it's a heart condition where there is an abnormal extra electrical pathway in the heart between the atria and the ventricles. This condition is congenital in the sense that one is born with it, but it's not necessarily something that manifests itself while the person is still young in childhood. It appears later on in life, often in adulthood, and can cause sudden electrical problems, fast heartbeats, which can very, very quickly lead to unconsciousness. The thing with WPW syndrome is it is very, very easy to detect on a simple heart electrical test, an ECG. The signs of it are right there on the ECG if you know what to look for. Your doctor finding it on an ECG can save a lot of lives. If you are a pilot or a commercial driver, you cannot work unless your electrical abnormality, WPW syndrome, has been treated. Imagine the catastrophe if your pilot with undiagnosed WPW goes into a tachycardia mid-air with you on board. It doesn't bear thinking. When I worked as a cardiologist, we used to do special medicals for pilots all the time and treat this sort of thing before it became a problem. A checkup is imperative, especially if you have a job where lives could be at risk should you keel over suddenly, not to talk of your own life, of course. Ion channelopathies. These are genetic disorders that affect the heart's ion channels, which are responsible for regulating electrical activity. Common ion channelopathies include long QT syndrome. This disorder prolongs the QT interval on an ECG electrocardiogram, increasing the risk of a particular type of heart rhythm problem called torsade de pointe, a dangerous arrhythmia that can lead to sudden cardiac arrest. Brugada syndrome. Brugada is a genetic condition characterized by abnormal ECG findings and an increased risk of sudden cardiac death due to ventricular fibrillation. This disease tends to affect young men, especially in Southeast Asia. And often people just go to sleep and never wake up again because the event happens in sleep. Very, very dangerous problem. Catecholaminergic polymorphic ventricular tachycardia, CPVT. This is an inherited disorder where stress or exercise induces abnormal heart rhythms, which can lead to sudden cardiac arrest in otherwise healthy individuals. This is the thing. This is why this particular problem is extremely dangerous. All you need is a little bit of adrenaline in the system due to an emotional stress event or just exercise, and that could be it. Extremely dangerous. Heart failure, characterized by the inability of the heart to pump sufficient blood, also can increase the risk of sudden cardiac arrest. In heart failure patients, electrical abnormalities such as prolonged QT interval and what we call conduction disturbances, so transmission of electrical signals within the heart tissue, often coexist with structural changes such as myocardial scarring, scar tissue within the heart. These factors contribute to the development of life-threatening arrhythmias. Heart failure can arise from various causes, including hypertension, coronary artery disease, and cardiomyopathies. The risk of sudden cardiac arrest is highest in individuals with severe heart failure, severe left ventricular dysfunction, particularly those with an ejection fraction of less than 35%, which is basically how much the blood can be pumped out of the heart with one pump action. So if, for example, we think of a normal ejection fraction as being around 60%, how much blood is pumped out of the heart with one effort, 35% is pretty low, and it's actually severe. So in patients with such a low ejection fraction, the risk of electrical problems can be astronomically high, unfortunately. Valvular heart disease. Now, valves, if they are defective, can also contribute to sudden cardiac arrest. Conditions like aortic stenosis, narrowing of the aortic valve, increase the risk of sudden death, especially during exertion, during exercise. The stenotic valve, so the narrowed down valve, leads to increased pressure in the left ventricle, hypertrophy, so thickening of the heart muscle, and potential electrical problems. In cases of mitral valve prolapse, which occurs when the mitral valve does not close properly, individuals may experience arrhythmias that could lead to sudden cardiac arrest. Although the absolute risk of sudden cardiac arrest in MVP, mitral valve prolapse, is low, it is still a recognized cause. Commotio cordis. Commotio cordis is a rare cause of sudden cardiac arrest that occurs when a blunt force hits the chest at a critical time during the heart electrical cycle. This impact can trigger ventricular fibrillation and sudden cardiac arrest, even in the absence of any underlying heart disease. It's most common in young athletes participating in sports like baseball, hockey, and lacrosse. It can also occur when people have a car accident and their chest hits the steering wheel during a particularly forceful impact. Drug and toxin-induced sudden cardiac arrest. Certain drugs and toxins, medicines, can precipitate sudden cardiac arrest by causing, sadly, fatal arrhythmias. For example, cocaine and amphetamines. These stimulants increase heart rate, blood pressure, and oxygen demand, which can lead to what we know to be ischemia, furring up or blocking up of the arteries around the heart, and subsequently arrhythmias. QT prolonging medications. There are certain medications which are everyday medications. These are, for example, antibiotics, even hay fever medications, which are known to prolong the QT interval and cause arrhythmias. These arrhythmias are of a special type, and I've mentioned this before. It's what we call the torsade de pointe arrhythmia. Dangerous but very treatable. Chronic alcohol abuse, which can lead to alcoholic cardiomyopathy, is also a recognized risk factor for sudden cardiac arrest due to its effects on the heart structure and electrical activity. Electrolyte imbalances. Electrolytes are basically minerals which are part of the blood system. If you have mineral imbalances, especially those involving potassium, calcium, and magnesium, these can disrupt the heart electrical activity and stability, leading to arrhythmias. Hypokalemia, low potassium, can prolong the QT interval and cause the particular type of arrhythmia that I mentioned, torsade de pointe. Likewise, high potassium hyperkalemia can do the same. Pacemaker dysfunction. We tend to think of pacemakers as the little electrical charger devices that we put into individuals to stop their heart from completely packing up on them. This is true, but we all have pacemakers, the original natural pacemaker. When this fails, we put in the artificial one. The heart, as we know from early on in this video, is both a plumbing and an electrical organ, much like the brain. There are many diseases and conditions that can affect our natural pacemaker, causing it to malfunction. One of them is Lyme disease, which we talked about not too long ago. Others include underactive thyroid disease, yes, heart attacks, yes, heart valve diseases, yes, electrolyte imbalances we just talked about, and also certain autoimmune conditions and medicines. The biggest culprits being beta blockers. Of course, if you are on a beta blocker, your doctor monitors your heart rate to make sure that it doesn't cause your heart to go too slowly. One important cause of pacemaker malfunction is simply old age. The natural pacemaker simply wears itself out with time. How do we prevent and manage sudden cardiac arrest? Given the wide range of underlying causes, prevention strategies for sudden cardiac arrest are multifaceted and often individualized based on a person's risk factors. Some key prevention and management strategies include screening and risk stratification. High-risk individuals, particularly those with a family history of sudden cardiac arrest, inherited heart conditions, or reduced ejection fractions, should undergo regular cardiac screenings, checkups. This can include electrocardiograms, ECG. I've told you how easy it is to diagnose some of these conditions just by looking at an ECG. They should also have echocardiograms, stress tests, and genetic testing where appropriate, because a lot of these are genetic conditions. Family history is often very important because it's the only indication sometimes of a problem, because very often these conditions are a one-time manifestation. Sometimes someone presents with death. They have just one episode and that's it. So unless it is screened for, we never find out until it is way too late. So if anyone in your family has died suddenly, no one knows why, it could well be a heart problem that was undiagnosed in that person. Go and have a checkup. Who knows? It may be something that is very, very quickly diagnosed in you, preventing you from the same fate. Implantable cardioverter defibrillators, or ICDs, are devices that we implant in high-risk individuals to detect and treat life-threatening arrhythmias by delivering shocks to restore normal heart rhythm when they go into a tachycardia, a fast heart rhythm. Often, the problem is diagnosed before the person gets an ICD, and not that we use ICDs to diagnose the problem. Only very rarely do we have to do this, thank goodness. These devices are particularly beneficial in individuals with heart failure, certain cardiomyopathies, especially hypertrophic cardiomyopathy, and people with a history of ventricular arrhythmias, like people with Brugada syndrome, for example. ICDs, as we talked about in the Golden Hour video, are absolutely life-saving when it comes to heart attacks. This is why in that first hour after a heart attack, it's handy to have an ICD present. This is why you find them all over the place, in airports, supermarkets, town halls, libraries, etc. It's because of this particular risk of an electrical problem which is quickly developing after a heart attack. Thankfully, this is rare, but it can happen. So why not have the treatment strategy in place, indeed out of hospital, so that the person can already have some treatment even before they get to hospital. This makes a huge difference. Medications in certain patients, medications such as beta blockers, antiarrhythmics, and other tablets called angiotensin converting enzymes, or so-called ACE inhibitors, can reduce the risk of sudden cardiac arrest, but it depends on what the cause of the problem is. Of course, lifestyle modifications also very important to prevent sudden cardiac arrest, by way of preventing one of its causes, which is coronary artery disease. So, lifestyle measures like maintaining a healthy diet, engaging in regular physical activity, managing your blood pressure to remain in a normal range, cholesterol levels due to a healthy diet, avoiding substance abuse. All of these are good measures to personally put in place to avoid this kind of problem in the future. Despite the measures we have in place to risk stratify and screen for people with a predisposition to sudden cardiac arrest, we still hear of sportsmen and women collapsing and dying whilst playing sport, children dying in the school playground, and bus drivers collapsing at the wheel in the middle of traffic. Many of these deaths are preventable. Sometimes the key to preventing such a death is staring you in the face. As I mentioned, a simple ECG done at your GP's surgery or your local emergency room when you go there for an unrelated problem. This can sometimes literally save your life. All my newly registered patients get an ECG, a checkup blood test to ensure you have the correct levels of minerals and salts in your blood is also helpful. A quick listen to your heart with a stethoscope is, in my view, obligatory for every new patient. Any suspicious heart murmur, and you are sent off immediately to the cardiologist for investigation, most likely for at least a heart echo test and ultrasound scan. We have established screening programs for common ailments nowadays. All women over 50 are invited for a mammogram. If you have a family history of breast cancer, even earlier. All men should get a blood PSA test, prostate-specific antigen test, after around 40 years of age on a yearly basis. All over 50s get a colonoscopy to screen them for colon cancer earlier when a relative has had this disease. There are, of course, specific occupational screenings or checkups for heart disease in every country. If you are a lorry driver or a pilot, for example, you will need to have certain rigorous medicals, as I alluded to earlier on in this video. But the average man and the average woman in the UK and also Switzerland can participate in whatever sporting events they wish without constraint. Maybe we should change this? What do you think? Are we too lax with our heart screening programs in the northern European countries? Should we take a leaf out of the book of the southern European countries? Or do you think there are already too many restrictions on our liberty as it is? Let me know in the comments what your thoughts are on this subject. As usual, if you have specific questions for me, I am at your service. Go on, ask a doc.